back to me. The only way I know that you can actually hear me, he needs to be talking back to me. Jason?
I'll text him and find out. I know he had to restart his computer.
Yeah. Okay. We're ready. Okay. The first thing I want to start off with is I've posted your grades in Blackboard from the farm test. I would encourage you to go back and review farm and make sure you, whatever it is your area was that you were the weakest, to really review your farm notes. Go back to a farm book to help you. Fourth semester is very big on farm. As far as the math as well as the type of categories and different things on the drugs. Okay. How many of y'all were in class on Thursday with Miss Stanley?
I believe all of us were.
Okay, all of y'all came. That's it. What was her lecture? What did she do?
Reviewed everything you said already.
So
she talked about the valves a little more and a little more in depth into hypertension.
Okay, yeah, she was supposed to do the hypertension. Did she do the hyperdiplomia case study?
Yes.
Okay, good deal. All right. So in terms of the cardiac exam, pretty much this is just right off the top from your terms. When we talk about sickle cell anemia, one thing about sickle cell, you want to make sure that the patient, in order for them to prevent crisis, what do they need to do?
Keep hydrated.
Okay.
Avoid infection.
Yes, avoid infections, keep hydrated. Anytime they start having any type of problems, start feeling sick of any sort, they need to go to the hospital, because a lot of times infection is what causes them to go into their crisis. That's usually the underlying problem. And when they do go into a sickle cell crisis, yes, we need to make sure we take care of hydration, oxygenation, pain, as well as fixing any underlying problem that could be causing that. Because remember, those cells are sickled and they can start causing things to be obstructed. They can go into kidney failure and all other things. And they can also have brain infarcts or have strokes and aneurysm and things like that. So it's very important to do really good teaching with them. When you have a patient who is think with patients who have problems with JVD or jugular vein distension, depending on what their condition may be, their cardiac condition. And many times, guys, if those are phones, you're going to have to cut them off or put me on mute. Okay, the problem usually when they have that jugular venous distension is because of the right atrium, the pressure in the right atrium has been elevated. So a lot of times these are those patients with high blood pressure and so on and so forth. So you watch those patients when it comes to JVD. During the night, we talked about that proximal nocturnal dyspnea. You remember those are those patients that during the night they feel like they're suffocating, so they jump up because they can't catch their breath, and their heart, they feel a lot of pressure around their heart, and many times they will sleep on pillows they like to elevate their head as high as they can, and sometimes it's hard for them to fall back to sleep. When patients are in heart failure, some things that you want to make sure you remember teaching, and I think I talked about this too, that one thing, if they start noticing that they're gaining weight in short period of time, or there's an adjustment in their weight, then we need to think about fluid volume overload, or they're retaining fluid of some sort. They need to get in and be seen, because with heart failure, that is a big problem for them, to have a lot of fluid around the heart, which can cause pressure on the heart, and at some point even cause them to have cardiac arrest or a myocardial infarction. So with heart failure, tell them to watch that fluid, and also be careful anytime they notice themselves gaining weight and shortness of breath and things of that nature. They need to be seen. Your major risk factors for patients who have hypertension, you got to think about what one of the bigger things is: cigarette smoke. People just don't realize how cigarette smoking can be the biggest issue of all. And then you just have patients who go around with this high blood pressure. They're not necessarily being seen or whatever, but their blood pressure is not total. It's not bad, but it's high enough to be seen and be considered as hypertension. So those are your major risk factors in hypertension. When we talk about rest pain, this is with peripheral artery disease, and it's usually due to chronic disease. Um, and this is where there's a decrease in blood or arterial blood to the nerves of the feet. So these are those patients with PAD that suffer from rest pain. Um, okay, so we talked about angina pain. What's some of the things that we usually do for patients who have angina?
Drug therapy,
What's the drugs?
beta blockers, ACE inhibitors.
What's one of our, if they have an attack, a patient starts to have, and these are usually your
Oh, okay.
chronic,
Nitroglycerin.
yeah, you want to make sure they have nitroglycerin on board, and what else? They need to do what?
They take the first one, and if it
Okay.
doesn't work,
You
they call
have a
911.
patient who has that stable angina. You guys really need to be studying this about the different types of angina. And with angina, especially chronic stable angina, many times when these patients rest and they take their nitroglycerin, they usually do fine, because what's happening is it's ischemia to the heart, those muscles of the heart, those vessels. If the patient rests and use their nitroglycerin like they're supposed to, that's considered stable angina, meaning these things will work as long as you do what needs to be done. Those patients who are unstable are those patients, no matter what you do, they end up having to come in because they're probably threatening a heart attack. Um, just remember, it basically, your patients with hypertension, lifestyle modification is very important. Um, the first thing that come to mind, what do you do to make sure that how can you modify your lifestyle if you have hypertension? What's one thing you can do?
Diet modifications.
Okay, so diet modifications, which would be what type of diet modifications?
You want to decrease your lipids, so your
Okay, so
LDL.
drop the fat intake.
Decrease
Okay,
salt intake.
yeah,
Correct.
decrease your salt intake. What
Low
else?
sodium.
Decrease your salt intake. What else?
Stop smoking. That's
Yeah, stop smoking. Those are like your top three things. If you stop doing that, but we also include, exercise. Guys, I really need you to cut the phones off or put me on mute, please.
Can't they put their mic on mute?
Yeah, I've been asking that. Okay. Okay, we talked about lifestyle changes. Think about also, this is another thing. When would a patient need to start when would they need to start being on blood pressure medication? When would you expect that?
If the lifestyle medications aren't reducing it.
or lifestyle modifications, right? If the modifications, if I started exercise, losing weight, I stopped eating so much extra salt, I've decreased my fat intake and just completely changed up my life, and I come in still with the high blood pressure, because usually when patients are coming in to have blood pressure checks, they're bringing them in every 3 to 6 months. And usually, if I've been trying to get your blood pressure under control and the medication, I mean, the lifestyle modification did not work, then it's time to start that patient on medication. Okay, good. Um, and what about your patients with primary hypertension? When they're walking around, if you got a person who has a normally high blood pressure all the time, how do they act? Stop it. Go. How do those
Normal.
patients with primary hypertension?
Sometimes,
Normal.
sometimes they don't know that they have it.
Right. They usually don't even know that they have high blood pressure. They're usually stable half the time. They never even feel like anything's wrong until they've passed out or had a stroke or whatever the situation may be. They come to the hospital and they say your blood pressure is so high or whatever. And they're like, oh, I've never had high blood pressure. And those are just these people who never check. But yes, primary hypertension, when they first are diagnosed, they don't even realize that they have a hypertension because there are no symptoms. When we're talking about drugs like hydrochlorothiazide, which is one of your blood pressure plus diuretics, that's the combo drug. That drug, what would you teach about that drug? Anna? Anna? Hello? What would you teach about that drug?
Watch potassium levels.
Mm-hmm. Okay. All right. Good deal. Okay. So,
Potassium.
yeah, and I'm hearing on both sides. Yes, Madison, that is correct. Um, Potassium. Potassium is a problem with hydrochlorothiazide because it's one of those potassium losing diuretics. So you would teach these patients about sources of potassium so that they can replace the potassium that's being lost. In addition to that, Anna stated, which is good also, is that they need to weigh themselves, watch their weight to make sure that, they're not gaining weight or having problems or having any fluid overload, as well as taking their blood pressure often. So good. Um, okay. What do you do with patients who come in that's dyspneic and have problems breathing? What is one of your things that you do as a nurse? What do you do for a patient who's having a problem when they come in with some type of cardiac or lung problem or whatever it is? That's how they present to you. What do you do first?
You check
Focus assessment.
You check what?
pulse,
Blood pressure. Check their
Okay.
blood pressure.
History?
the vitals.
Think about I'm coming in right now. I've coming in. I'm having shortness of breath, coughing. I just can't seem to get it together. What's the thing you want to check for?
Oxygen level.
Listen to the lungs and
Okay, think about that. Anytime that you have a patient, I heard the word assessment. I want to know what the assessment was. Yes, auscultate the lungs, listen to the patient. Yes, in addition to that, you do want to do a pulse ox check. We want to see if we need to get this patient on oxygen right away. Remember, assessment comes first before you do anything. Now, will it be a full body assessment? Probably not. It's going to be a what kind of assessment?
Focused.
Focused. You want to just concentrate on what my issue is right now, get you stable, then we move on. So yes, auscultate the lungs. Yes, you want to check the spot, you want to check the oxygen saturations, because if I need to put oxygen on this patient, get ready to perform CPR, all this stuff, I'm ready to do what I have to do. So think about your patients who you need to see first. Think about the things that What's some of the signs and symptoms that something's going on with the patient that will give you a reason to see that patient first? Think about an elderly patient. What's something that could be happening, letting you know something might be wrong?
Altered mental status?
Okay, altered mental status or confusion, restlessness. They're laying there and they're thrashing in the bed or whatever. So think about your number of patients, and this is several of these type. The way I'm saying this question here or saying this particular comment, when you're dealing with patients, think about what could happen or what are they doing that's letting me know they're having some type of issue with either breathing or they're about to have a heart attack. And think more of your older patient, because what else did that patient start to show signs of? What's happening to them when they're having some type of distress? What's some of those little things when you have anxiety, what do you feel?
Shortness of breath.
Irritable, possible oxygen deprivation kind of thing?
Yeah, that's going on. We've already determined that's what's going on. But how do you start to feel as a patient or as a person when you have a lot of anxiety? You're afraid something's wrong. You feel doom. What's some of those things, those mechanisms? What's some of those signs and symptoms of things that you even do now when you're preparing for something or you have anxiety about something?
Increase the heart rate.
Okay, you not necessarily, you can hyperventilate, you can increase your heart rate as well. I heard you, Anna and Wendy. Well, some of those mechanisms that happens, it's the body's way of trying to compensate. And have you ever felt a person's hand when they are anxious about something?
Jitters.
They're usually cold and clammy, aren't they?
Sweaty.
Yeah, they're kind of sweaty and clammy. So think about those are the kind of patients you want to be trying to look. You might want to check those patients out. We talked about morphine and Lasix. That's usually used with those patients who have heart failure. You'll see Lasix to get rid of the fluid and morphine for the pain. What should you notice when a patient has taken Lasix and morphine who's come in with problems with breathing or issues with shortness of breath?
Maybe decreased respirations?
Okay, the respirations may decrease, but what's really decreasing?
Oxygen.
Okay, think about what I just said. You're dealing with the patient who's coming in with shortness of breath and pain, because you know they usually have pain. They're probably grasping their chest. We raise the head of their bed, and you find this patient here on Lasix now and on morphine. What should you see?
A slow the heart rate?
Okay, guys, if you have anything going on in the background, you're going to have to cut the phones off because it's completely wiping out everything. I can't hear. So put me on mute, please. Now, if you're going to answer, you can take me off mute long enough to say your answer and then jump back in. Okay?
Would their hearing be impaired?
No, this has nothing to do with hearing. We're talking about, are you talking about, huh?
Their stability.
Okay. You have a patient on Lasix and morphine. You're dealing with a patient who's coming in dyspneic or shortness of breath. Now, I put you on this medication. What is that medication supposed to do for me? What is Lasix going to do?
Sometimes the potassium level.
Listen, I don't want to talk about that. What does the Lasix supposed to do for a patient with heart failure or having shortness of breath? What is it going to do? What is the responsibility?
It's going to get rid of that fluid.
Okay, it's going to get rid of the fluid, which is also causing this shortness of breath because you have all this pressure. I'm also having pain, so I'm giving you morphine to help basically open up those vessels, make you relax. Now that I've done that, what response should you see?
Better
The
breathing.
shortness of breath should
Better
be
breathing.
gone.
Yeah, the shortness of breath is going to go away. Exactly. That's all I want y'all to understand. You have to understand why they're getting the Lasix and why they're getting the morphine. Why are we giving this to a cardiac patient or a patient who's having shortness of breath and so on and so forth? Okay. You need to understand atherosclerosis, especially when you're teaching a patient about what's happened. Basically, what's going on? What's going on with atherosclerosis?
The arteries are hardening.
Okay, but why? They're
Plaque
narrowing.
buildup.
Buildup.
Buildup of what?
Plaque.
Plaque.
What is that plaque? Okay, you guys really need to go back. You need to understand what it is. What is that? What's causing that plaque to build up? What's causing those arteries to become more narrow? We're talking about
The excess of
atherosclerosis.
lipids.
Okay, so
fats.
excess of fats, correct? What else? What's building up in there? If I'm narrowing and narrowing and narrowing, what else is building up in there?
Bacteria.
What were you saying, Anna? Well, that's a part of it, but that's not that. Maybe this is not a patient who smokes.
What
Okay, what's supposed to go through the vessels? What's supposed to go through the
Blood.
vessels?
Clotting.
Okay, so would
Thrombus.
it be so you would right? So the platelets are going to build up there. So you have a buildup of platelets and fat and whatever else. Yes, there's going to probably be bacteria and everything else in there. But when you're discussing this with someone, why do we have atherosclerosis? What is causing that plaque? What is causing that to build up? Okay, you have a patient who's taking medication for treatment for high cholesterol. Some of those drugs are your statin drugs. What would be something you would want to, what would you want to be able to teach a patient about side effects? If you don't know the answer to this, don't guess. This is just basically letting you know you need to understand your side effects of Zocor or your simvastatins or any of your statins for cholesterol. But what would be one of the side effects that you might want to report to the healthcare provider? Okay. Nobody knows? Okay.
Would weight gain be?
Don't guess at it. Just go look it up. That's fine. If y'all don't know it, that's fine. Just make sure you know it next week. When you have an abdominal aortic aneurysm, which you may see it in AAA. What would you be concerned about this patient who has AAA? What's some of the complications that would make you feel that something's going wrong?
Bleeding, like internal bleeding.
Okay. So when you have internal bleeding, what bleeding starts to do?
It's gonna make your blood pressure lower, wouldn't it?
But what is it? What's bleeding? If you're bleeding out somewhere, what is that blood gonna start doing?
Bruising, patchy, molting.
It's gonna start filling up the spaces where it's bleeding
Okay,
out
so it's
into.
gonna do what? What is it going to do? What does standing blood do?
Clot.
Okay, it clots off. So if things begin to clot, can that start up causing obstruction?
Yeah.
Does that make sense? So now this is that patient now that's going to start complaining of left flank pain. And also this patient, as you notice, is going to drop what?
Blood pressure.
That's fine. Blood pressure is probably actually going to go up. What is going to start being a problem for this patient?
Anemia. I don't know.
Think about it. You have your patient now has left flank pain. He
Chest
has
pain.
an abdominal aortic aneurysm. He could be bleeding out. There could be some clots that are forming, can cause clots to cause other organs not to function appropriately. What's some signs and symptoms to let you know one of these organs is failing or could fail because of what? Anna, were you getting ready to say something? No,
Decrease
not quite.
urinary output?
Yeah, you think about the urinary output. That's something that you would want to be able to exactly, because what now is it going to affect? The renal
The
system, right?
kidneys.
Yeah, so you're going to have your immobilization of the renal artery is going to have these clots going around, and it's going to cause what is it going to cause to the urine? What's going to cause, what's going to happen to that urine? What's going to happen to the urine for this patient?
It's going to be bloody?
Wendy, what's going to happen to that urine?
Bloody urine?
Urine.
What's going to happen to the urine? There's going to be a decrease in urine output, right?
It's going to, yeah, and it's going to
Okay.
be like urinary stasis.
Could be. Absolutely. Let's see. What do you want to prevent in a patient who has angina? What is one of your ways to help promote myocardial oxygen flow, to decrease that demand for oxygen in the heart, to decrease the demand for oxygen for the heart, and also promote coronary blood flow? What are those things that you want to do as a nurse to try to prevent? What is a prevention when they have angina?
Vasodilators.
What about dilators?
Aspirin.
Oh no, I'm
Nitroglycerin.
talking about giving the drugs. No, who is this? Is this Mr. Sean?
Yeah.
Hey, Sean.
Hey.
You're off work. Okay.
Yep.
But as a nurse, think about it for a second. You have a patient who has angina. What's some things that you can do to promote coronary artery flow? What would you want to prevent in this patient? We're talking about the heart. What do you want to prevent happening? So yes, you may be putting
blockages
them on
coronary arteries.
Okay, so what you're going to give them their medication, this, that, and other. So these are those patients probably on those beta blockers or whatever. But what would you, and those drugs are going to help do what?
Slow down.
Decrease blood pressure.
They're working on the blood pressure, but what's the purpose of those cardiac medications?
They're going to dilate the arteries, the
Okay, we
vasodilators.
got that. Sean said that. But what is it going to do?
It's going to decrease the work of the heart.
Okay, it's going to decrease the work of the heart, so therefore dropping the heart rate. So what is your job? To do what? Do everything you can, making sure they get their medication on time. If they're needing an aspirin a day or nitroglycerin every now and then when they're having angina pain, you want to decrease the work of the heart. You don't want that heart rate to be increasing. So yes, you want to do that. Good. I'm making y'all talk through this because a lot of this is a patho thing and a lot of it is coming from that farm. So you're going to have to really, really work with this as you guys are studying. You have a patient with hypercholesterolemia, high cholesterol, basically. Okay. Let me see how I want to put this one. What's some of those foods that are basically high in cholesterol that you want to teach patients not to eat, or to decrease consumption of?
Hamburger.
I know, right? Yeah, your fast food, definitely. What is some of those favorite meals that you can't stand?
Red meats.
Fries.
Okay. Name one of those foods.
Red meats, eggs, whole
One
milk.
of the foods. Name it.
Oh, steak.
Okay. Give me another one.
Garlic.
It's a meat.
Pork, bacon.
Okay. Keep going.
Ham.
Keep going. Because what is your drug? This is the one it's just high in cholesterol. It's one of those that people, believe it or not, it's actually really good for you. But eating a lot of it can cause you, a lot of it can cause you to have your
Chicken.
Who?
Chicken.
No, give me another one. Anna, can you think of it? Okay.
Ish.
Liver? What did you say? Okay, yeah, but liver is correct. Liver is correct. Okay.
That's where animals turn things into cholesterol. Read about
What
that.
does a patient look like that has a venous ulcer? Usually, where do you find these venous ulcers?
On the extremities,
Yeah, which extremities?
Leg.
lower.
Legs.
More of the
The
lower,
lower
yeah,
leg.
more of the lower extremities. And what do they usually look like?
Bruising?
What would you, well, if you were assessing that, what would that venous ulcer look like?
Like a little tiny spot that's kind of
You would,
blackish?
yeah, it's dark. Yeah, that's right. It's kind of brownish. It's more brown, and after it gets old, it can look more black. But yeah, more of a brownish, dark brownish looking color. Good. You kind of think about DVT also when you're thinking about when you're looking at that, and you're like, oh, that doesn't look right. So you would question it, but that's usually around the ulcer site of the ankle or the lower extremities. Good. You remember there was the angioplasty, and usually what they do when they do angioplasty, they do laser. What's one of those things that you want to watch the patient for?
Bleeding at the side of the
Okay.
entry?
Yep, bleeding. Very, very important. Good. Good, good, good. Because these are those patients, a lot of times after they've had the procedure, they like to leave them flat and they watch the bleeding to make sure. Good job. Good, good. Okay, so compartment syndrome. We talked about this, and because of compartment syndrome, this a lot of times can affect the heart. What have you always learned about compartment syndrome and prevention? Or what to do if you think a patient has developed compartment syndrome?
If it's from a cast, you want to remove the cast, right?
If it is, but if it most of the time it's something wrapped around it, so you would loosen it up. Okay, and what would you do with the extremity?
Elevate it.
Yeah, elevate it. Just it's the simple stuff that I'm really asking. You want to elevate it above the heart. Use the level of the heart. Good. We talked about Raynaud's or disease. And you remember I was telling you about those patients who have Raynaud's. It's got, if you remember the picture on the screen, how their hands pretty much just turn white. What's a teaching you want to teach a patient about that?
Wear gloves when they're outside.
Yeah, when they're going to be exposed to cool temperatures, and also when they're working in their yard and, pulling up the rose bushes with all the thorns, because they don't even feel that they've even cut their fingers. And when it's cold outside, it causes that even worse decrease in circulation in the hands. So yeah, wear gloves and cool temperatures. Good. What's one of those things that we teach about chronic venous stasis ulcers? What's something that a patient who has that problem, what would we be teaching them on a daily basis? Think about it. You got your lower extremities that have problems with venous stasis. What do you probably want to teach that patient?
Don't sit for long periods of time.
To
Okay, what else?
move and stay active.
Okay, what else?
Well, they've probably got
You have to
peripheral
check it.
neuropathy also.
Inspect
So
your,
what do you want to teach them
to
to do
check,
every day?
check them. Inspect
Okay.
them.
What can they do to help prevent this problem continuing? What controls it? Anna, can you think of it?
Prevention of blood clot.
To prevent it is usually in people that are obese, and
Okay.
that. So I mean, just losing weight. Yeah.
Okay, what did you say, Anna?
Would they want to wear
Okay.
compression stockings?
Okay, exactly. Just simple as anti-embolism stockings. Simple as that. These are those patients that you teach. They have chronic. That word that stands out more in this particular term is chronic venous stasis. Those are those patients you see walking around with their anti-immobilism stockings, those TED hose. Those are the ones get up in the mornings putting them on. That's pretty much basically what I want you to get out of that. Prenavil is one of those drugs or those Pril drugs. What is it? What is one of those side effects you have to watch for those Pril drugs? The Prenavil, lisinopril, all of those. What's something you need to really watch to monitor the patient for?
Hypotension.
Yeah, orthostatic hypotension. Good. Um, Okay, we were talking about primary hypertension earlier, and we know that those are those patients walk around with no symptoms many times, and it's already late before they realize they even have it, and we're having to get their blood pressure down in an emergency situation. What about these patients with essential hypertension? Do we even know what causes hypertension necessarily?
No.
Yeah, we really don't know what causes it, but we know that those who are higher risk for it are your smokers, your drinkers, your sedentary lifestyle, those who are high fat high fat diets, and
High sodium.
those high sodium diets, exactly. So those are all the ones that we look at like, well, we don't know what actually causes it, but hey, this is what I want to teach you, that we notice lifestyle changes can help a lot. So when we talked about Berger's disease, I don't know if y'all got a chance to look at that, but what's one of those things that can help this patient disease process to limit itself, basically slow down? What's one of those big things that we need to teach?
Stop smoking.
Stop smoking. Yep, just stop smoking. And I think now they're actually putting something else in these cigarettes because people are really, really they're paying more for cigarettes, but you're noticing Berger's disease, cancer, all of this stuff is coming back really, really rough now than it used to be. Let's see. Okay. Okay, which values are risk for? Okay, so who are your patients at risk for atherosclerosis? We talked about those patients with high fat, which is causing what to be elevated? What's elevated on the labs when you have high fat?
Your lipids.
What is that called?
A high
What's
LDL.
elevated?
Your LDL.
LDL is
Triglycerides.
Yes, the LDLs, the triglycerides are elevated. The total cholesterol itself is going to be elevated. And then you have this hormone called, which I think is one of your terms, homocysteine. Good.
Your HDL is going to be low usually.
Yeah. Don't be too low, right? And that's the one they're trying to get it elevated and get the low dirty or the low density cholesterol lowered. Good. And that's when you start seeing those statins come on board. We're like, okay, your total cholesterol is 209. It's borderline. However, your LDL is really high and your overall cholesterol is too high. So sometimes you'll see them after a while, they have to go. And even after they've done their lifestyle modifications. Let's see. You have patients, also remember, think about patients who deal with cardiac disease. A lot of them are in denial because they'll sometimes feel like, hey, I've never been sick. And you may find those patients who won't report their disease process for a while. So, kind of watch that and make sure that you do some good teaching on that. You need to know your non-selective beta blocking agents and know the side effects. What's one of the, and this is one of them that I know somebody who deals with this. What is one of your side effects of non-selective beta blocking agents?
Bronchoconstriction.
Okay, great. So what do you see and hear a lot of on these patients?
Wheezing.
Yeah, that's good. Good. Okay, yeah, that's one of your common ones. And then you have a lot of the other ones that beta blockers that the patient experiences a lot of coughing. Good job.
What does it cause? Bronchoconstriction?
Yeah, so wheezing. You hear wheezing.
Okay.
You can see it, and that is it, bronchoconstriction. And you'll find them coughing too. So, but wheezing would be the most. That would be the one that you would see complicate. That's a complication of non-selective beta blockers. Bottom line, wheezing.
Okay.
But most of the time, they try and give people cardioselective beta blockers, right?
Yeah.
As
The ones
opposed to
that that's everybody that's on the when they have that wheezing, they come into the hospital because that's considered not a good side effect. Nobody should be wheezing because if it's constricting, now we're going to have other problems, right? So it is definitely a complication that needs to be monitored. Yeah. So yes, they do try to get the ones that are more because remember when we're dealing with the heart, the lungs got to be in order too, right? We have to have both of them working together. We can't just be just treating the heart. So yes, that's a good note to make there. Oh, okay. I just talked about when I was saying about how patients may not accept the fact that they do have a cardiac issue. Lots of people with cardiac issues will go into denial. And then you have those who might not even call the doctor until a while before. Like I've been experiencing this, but it's been going on for a couple of hours. So watch those patients. Make sure you do some really good teaching. Make sure you give them pamphlets, things like that to kind of get them to understand. Do you remember? I think I was talking about this on one of the slides. Which one of the procedures that you have to have an informed consent?
TEE.
Angioplasty, angiograph.
any surgical procedure.
If it's a surgical procedure, yes. But the one that requires an informed consent, what did you say, Victoria?
Cardiac catheterization.
Okay.
TEE.
Yeah, the
Transesophageal.
transesophageal echocardiogram. That is your main one for the informed consent. You also need to understand who obtains that consent.
Doctor.
Okay. And what do you do as a nurse?
Confirm that it's signed.
You confirm, correct.
Okay.
Good. You make sure that it's signed and that the patient doesn't have any additional questions. Great. Okay, y'all okay looking at that. That's good. Okay, when a person has anemia, what's one of the things as a nurse that you need to be very cognizant of?
Hydration.
Bleeding.
Okay, all of that's great. So, okay, let's go back. What happens if I'm bleeding? What's one of the signs is going to show me that something's wrong? So if I'm bleeding, if you're talking, you need to speak up.
Your HH levels are going low.
I heard something about heart rate, but I can't hear it. So somebody say something about the heart rate?
Elevated.
Yeah, somebody said it a while ago. It was really low. But when it comes to the heart rate, think about a patient that's anemic. What can happen to that patient when they're anemic and they're bleeding somewhere? What can happen to them? They can go into what?
Shock.
They can go into shock. And what's one of your signs and symptoms of problems with shock?
Hypotension.
No, the answer is still heart rate, elevated heart rate.
Tachycardia.
Remember, they become tachycardic at first. Y'all remember shock, don't you? Y'all should be remembering shock. One of the first signs that you'll see is elevated heart rate. So think about that patient, correlate this patient that's anemic. Now, I wouldn't dare get this patient up out the bed knowing that they're losing blood, because what's going to happen? Their heart rate's probably going to go up. And if it's up, I wouldn't dare try to get them out of bed. We would try to figure out how we can correct the problem. Okay. What about mitral stenosis? What's a sign or symptom of something's wrong?
Hair murmur.
No, not necessarily.
Can you repeat the question?
But the with mitral stenosis, you can hear the murmur, but it doesn't necessarily show anything's wrong. What can the patient do to let you know that something's wrong? They start having problems with what?
Breathing.
Okay, breathing. They start having dyspnea and shortness of breath. Good. Remember, the heart and the lungs do have to go. They have to work together. Okay, good. Okay, so you have a patient who has gone down for a aortic valve replacement. What would is not right.
What was the question?
A patient has gone for a aortic valve replacement. What alerts you that something's not right?
Irregular rhythm?
No. Well, that would be not right. But think about the things that, okay, your patient has gone for this valve replacement. You can actually have clots or something like that that can actually be, that can happen during this procedure. Clots can roll around, to the lungs, this, that, and the other, and the legs. What happens if it's a clot as far as the legs? Because they probably did the aortic valve replacement going through the femoral artery. I'm not sure if that's what they did, depending on, we don't want to read into it. But what if there's a problem with the legs? What's some things that show you something's wrong when the leg, if there's a clot? What happens to the
Pain and
leg?
pain.
Pain.
They might be agitated, right?
Yeah, they could be agitated, so they have pain. Could they have pulselessness? Could they be pulseless?
Yes.
Yeah.
Okay, what about
Decreased
coolness to the
sensation.
leg? Yeah, right, pallor, paresthesia. Good. Okay,
Basically,
good.
they're
So,
neurovascular checks, what we're doing when we check those.
right. In that, right, that's true. You can think about it, neurovascular checks. Okay, I like that. Good. All right, so it was a lot of stuff there, so y'all might want to really go back and look over that. Let's see. Hypertension, there's a lot of stuff there. She should have went through a lot of the hypertension because I asked her to, since I didn't get a chance to really work with hypertension, as well as the hyperlipidemia. One thing that you need to understand is you need to know your labs, and I think I put those on there, like you need to know what's the normal serum creatinine. And you also need to know what determines whether there is if there's organ damage. And many times you got to watch that serum creatinine. But there's other labs that I put on there, so you need to make sure you go back and review that. Okay. What's the sign and symptom of varicose veins?
Pain.
Pain.
Itchy.
Itching. Yeah, exactly. Okay. What if you hear a swishing sound around the carotid?
Heart murmur.
No.
Oh.
You hear this swishing sound going across the carotid. What is that called? Swishing sound.
Valve.
You're listening to carotid and you hear a swishing sound. That's called a bruit, right?
Oh, yeah.
Is that normal?
No.
No.
Okay, so what would you do?
Call the doctor.
Okay, good. Now you guys need to go look at the bruit and listen to what a bruit sounds like and understand why it's not normal to hear a bruit over the carotid. Okay, nipride, NIPRIDE, is used to do what?
The question again, please.
What is nipride used for? Ooh. Y'all truly don't know what nipride is used for?
Yeah.
Oh,
Okay,
nipride.
NIPRIDE. I spelled it the first time.
Sorry.
So, tell me about it.
Vasodilation?
What?
Vasodilation.
To do what? What is it supposed to be doing? Why am I giving this drug?
Reduce blood pressure.
Blood pressure? Great. So how do I infuse this drug?
IV.
Okay. What else? Look it up. You guys got it there, and somebody get back with me.
From light.
Oh, okay. Good. Good. Need to understand systolic failure. What happens in systolic failure? And what is the purpose of us giving nitroglycerin to the patient? When we have patients with angina, why are we giving it to the patient? Hello? Anybody out there?
Oh, I'm sorry. I thought I hit my mic. Dilating peripheral blood vessels and
So what is the purpose
coronary
of giving me, why are you giving me nitroglycerin? I have angina. What's happening to me?
They're constricting. You want to open them up
Okay.
and get blood
How
flow
do I
going.
act when I come in when I have angina?
Trouble
What am I
breathing.
doing?
Chest pain? You have
Yeah, I
chest
have
pain?
chest pain. So why do I give you the nitroglycerin?
Stop the chest pain.
It's going to stop the chest pain, which in turn is dilating the blood vessels, allowing the blood to flow. It's still the same. When you're giving giving nitroglycerin, we're also covering the pain. Y'all got to remember that you're not just giving nitroglycerin just for the dilation, but what's happening here is supposed to also cover the pain. Go back to your angina, please, please, please. Your math is going to be the type of question like micrograms per kilogram, and the weight of the patient will be there. And I think I'm going to go ahead and keep it. It's also going to be a drop factor question on there. Okay, so we know prevention for basically any type of prevention. If they stop smoking, they can help their heart and their lungs.
Hello?
You need to understand left ventricular hypertrophy. This is where the maximum impulse, the point of maximal impulse can be misplaced, can be displaced when listening to it, can be in the 6th or 7th intercostal space. So you need to understand left ventricular hypertrophy. Understand the drug clonidine. The drug can never be stopped abruptly. You need to understand the pericarditis, and basically think about patients with cardiac tamponade. Those are those patients you need to really watch for cardiac tamponade, vein distension, jugular vein distension, muffled heart sounds. Those things you need to watch that patient. And then I told you what the type of math will be. A couple of things, lots of things. I know it's a lot more that I haven't fully covered, but it's a lot of stuff with cardiac. I know that's way more than you're thinking, God. But of course I don't have the 50 questions here. I just got a lot of notes, and these are all coming from your terms. I gave you the page numbers of the terms. And if I were you, if you've got your ATI books, and this is what students are saying, they're going to their ATI books and actually pulling open the actual cardiac area, and it's kind of like a shortened version of your book and breaking down a lot of this. So each little term that's on there, go look it up in the book, as well as go to ATI. Make sure you do the interactive review questions. Did y'all get the cardiac clicker questions?
Yes.
Yes.
Okay. Go and find can you send the math? I've already told you what the math is, so you can look that up in your book. You can get that out of your you guys have, I don't know what your math book is, but drop factor is the same
drug
drop factor.
calculation book.
Yeah, the drug calculation book. The drop factor is the same thing you've been doing forever. And the micrograms per kilogram with the weight is similar to a question that you had in the last exam. So you guys need to go to that book. And I'm going to urge you again to really get your farm down, because farm is going to come back and bite you on the HESI. I can promise you that, as well as when you get to 4th semester. I do appreciate everybody going to the class. That really makes the sub or person that's coming in to teach feel really good, and I hope that she was able to give you what it is that you needed, because like I said, I wasn't able to be there. On top of that, what else do I need to tell you guys? I haven't picked the test yet. I'm not sure. I'm going to go in and pick the test probably either tomorrow or Monday and set it up for you guys for Thursday. I might not pick it till Wednesday. Who knows? It just depends. Can't think of anything else. Does anybody have any specific questions for me?
No.
I hope this was helpful in some way. I just got
It
a lot of
was.
notes
Thank
written.
you.
I have a lot of notes. You're welcome. I have a lot of notes written up here, and I'm kind of looking back to make sure I didn't. Okay, but if you think of any questions, I mean, I started my new job already, so I've been gone with that all week. That's why I had a little time to try to get you guys do a little review with you today. And so Jason has recorded this. And if so, please post on YouTube is what he did last time, right?
Yeah.
And if anybody else posted it, send it to me as well. I want you guys to really, really do well. I want you guys, because a lot of people on respiratory, which y'all did awesome, as well as cardiac is the test that actually brings you guys up. I've already opened up the psych information. Soon after you take your cardiac, I know you're like, thank God we're done with this, but you've got to jump into your psych. Do not let your psych test bring your grade down, please. Do not let it do it, because you want to go in hard and strong when you get ready to go into HESI. HESI is a busy test. I mean, it's just, you think about there's 100 and some questions. Hello? Okay. Yeah, I don't need that on there. There are some questions on there or whatever. So just really want you guys to go in there really doing well. And I hope you started your HESI studying. I know you're like, oh, Ms. Schultz, I can only do one thing at a time, but you guys really, really need to go back and get it going. Are there questions for me?
I didn't have anything to
No.
do.
Thank you, Ms. Schultz.
Okay, you're welcome. And I look forward to seeing you guys on next week. If you do have questions, send me an email and I'll answer it. If it's a question that can be posed to the whole class, I'll send it to the whole class. And I'll respond as soon as I'm able, because like I say, I'm at work all day until 7 tomorrow. All right, we'll talk later.
Thank you.
Okay,
Thank
you're welcome.
you.
Bye-bye.
Bye.
Bye-bye.